want to turn things over to our presenter this afternoon. So Kelly, you can unmute yourself and take it away.
Thanks, Derek. Hi, everybody. Welcome to the Kernel of Knowledge webinar, and welcome to the 1 p.m. time for us here in the Midwest, which is right after lunch. So I'm either going to put you to sleep or keep you entertained after lunch. That can be up to you. I am, however, going to get this moved into, there we go, over to my slides, but I am going to stop the video. So this is me saying hi and bye because I don't want to affect the bandwidth. So you'll still be able to hear me, but you don't have to look at my face. You can look at the slides for the time period coming up here. So I'm going to do that and make it so you don't have to worry about that, and we will go ahead and I will get started. My name is Kelly Thormanson, and I am the Director of Library Resources at the School of Medicine and Health Sciences at the University of North Dakota. My team is part of the session, and I'm having technical difficulties here. Hold on one second. There we go. This is my team. They're the outreach team here at the UND Library Resources. Marcia Francis, who is in our Bismarck location. Don Hackman, who used to be with the team and is still finishing this particular project, but now works for the University of Minnesota. Erica Johnson, who is in the Fargo campus. Michael Skinner, who is at our Minot campus. And then myself there with less red in my hair back then. This is an older picture. Shh. Anywho, this is the team, and we're the ones who we're doing this outreach project that we're going to talk about today related to the rural needs assessment of healthcare workers in North Dakota. So first off, disclosures, of course, we were funded by the GMR. So we've been funded for the last 3 years under the GMR for this particular project. And we have IRB approval for phase 1 and phase 2 of the projects from the UND's IRB. I have a little bit of housekeeping as well, and that is, yes, please put your questions in the chat box throughout. You don't have to wait to do that. The members of my team are on this webinar, and they can answer those questions right away if need be, if they think the answer needs to be answered right away. So please put those questions in there. And also, I am going to be taking a break at midpoint so we can have questions at that time and at the end of the presentation. So, you know, if you don't want to forget the question, get it in the inbox, and they'll either answer you right away or we'll answer you at the midpoint or at the end. So obviously, North Dakota is a fairly rural state, but I thought maybe we could start this with a little poll. Does anybody know the population of North Dakota? Go ahead and type it in the chat box if you think you know what it is. And no cheating librarians and looking up the answer. Take a wild guess. What is the population of North Dakota? 2 million, nice. 1.5, 1.5, 1, 50,000, okay, that's a little low. 1,500,000. Well, that's awesome. You guys are great. 700,000 people. 800. Somebody got so the 500 and 800 are close. Good. So the state of North Dakota has approximately 700,000 people. I just recently learned we have a Center for Rural Health here, and it was National Rural Health Day. And they let me know that there are actually more cows than people in the state of North Dakota. It is about the population of Denver. So it is that's not a lot of people in a lot of space, because North Dakota is pretty big. I'll actually show you a little bit later how big it is. So how many healthcare workers in this state of 700,000? How many healthcare workers do you think are in North Dakota? The entire state. There's 700,000 people. How many of them are healthcare workers? 2,000, 10,000, 40,000, 20, 40, 50. Awesome. 30,000, 20,000. That's pretty good guesses. 24,500 healthcare workers. The last time there was a census, a labor bureau census done on job titles. So we have 24,500 approximately healthcare workers in the state. How many health sciences librarians do you think are in North Dakota? So we have 700,000 people. We have 24,000 healthcare workers. How many health science librarians are here in North Dakota? So I saw 100, 5, 10, 5, 50, 25, 4, 15, 15,000. It might be a little high. 35, 200. Oh, this is all good. Good. 14. There are 14 health sciences librarians in the state of North Dakota right now. Yes, wow. That's what we say. Wow, there's only 14. That's really, yes, there is. Let me show you what it looks like. So here's the state of North Dakota. To get an idea of size, it takes about 8 hours to drive from the eastern border to the western border of the state, and probably about 5 hours to go from the north to the south. If you're not familiar with where North Dakota sits, our northern border is Canada, and then Montana to the west, South Dakota to the south, and Minnesota to the east. In large print, you see the 4 largest cities in the state of North Dakota: Minot, Grand Forks, Bismarck, and Fargo. And to explain something about the 14 librarians that are health science librarians left in the state, Grand Forks in the upper right quadrant, that is where the University of North Dakota is. University of North Dakota School of Medicine and Health Sciences sits here. We have our first 2 years of med school students here. And then we're not affiliated with a hospital, so our med students and our residents get spread out over the whole state. And so we actually have campuses in Minot, Bismarck, and Fargo. So they have a home base in each of those quadrants for those medical students and residents. And then we have librarians then in each of those places as well. So here in Grand Forks at the main campus, there are 6 health science librarians. In Minot, where I introduced earlier, Michael Skinner he is a UND employee. He works for me some of the time. He is also a part-time hospital librarian. We have a dual agreement with the hospital system there. So part of the time he runs the hospital library and part of the time he works for UND. Down in Bismarck, Marcia Francis, who is our UND librarian there. In Fargo, Erica Fisher is the Southeast Campus librarian. So that's 9 librarians so far. 9, they're all UND employees, and that's 9 of 14. The other 5 librarians are 3 hospital librarians and 2 non-UND academic health librarians, and they are all located in Fargo. So of the 14, all but 2 are right on the border to Minnesota. The other 2 are, hey, Marette, holla. She's one of our 2 non-UND academic health librarians in the state. The other 2 are on the other side of the state. So not only is this a big state and there's only 14 of us, most of us are kind of hugging the line to Minnesota, and there's only 2 in the large part of the state. Yeah, it's not a lot of coverage. I agree. So a little more about the libraries here. UND School of Medicine and Health Sciences Library Resources, which is what we are called now. We're the only academic health sciences library in the state. There is, and I'll correct, Marette is on the call here. She is at North Dakota State University in Fargo. She does have a library, but it's currently under renovation, so it's not open. So I'm the only one that currently is open and running. I have a very small physical collection. In fact, you can see it on those 2 shelves there in the picture. This is a picture of our information desk. It's a shared information desk between the library and IT for our entire building, the entire School of Medicine and Health Sciences. But that's all I have left for books back there. And everything else is online. We are a primarily digital library. We built a brand new building in 2016, and since that time we have been a digital library. We don't have any stacks of books, and our librarians are actually embedded in the building. What you see of the library there, that's pretty much it, except for a couple offices behind the door. The librarians are up sitting with the faculty. So this is it for us. So we're not really a place for people to come find the information either, because we don't have a lot of traditional library stuff. There's 3 physical hospital libraries left in the state. One of them is, as I mentioned, in Minot, the dual relationship we have with Trinity. There is one at the VA in Fargo, and there's a state mental institution, state mental hospital. They have a library. They do not have a librarian, though. They have somebody who does ILLs, but they don't have a librarian. They have a library, though, so I counted it as one of the hospital libraries. And then Sanford Health has one virtual hospital library. And they cover the entire state of North Dakota and northern Minnesota from their one virtual hospital library. And the 2 librarians that staff that are in Fargo. So this is kind of the picture right now for the state. If you can kind of imagine that, there's not a lot of us, not a lot of hospital libraries, not a lot of libraries, health science libraries in general. So you're going to like this segue because I love the word therefore. Therefore, we knew that we were in need of doing a little research. We've been talking about this for a while. I mean, they've been closing hospital libraries for years. In fact, we've just lost another one here in 2018 in North Dakota. So we know that stuff was happening for many years. And in 2015, we really said, there's not a lot left. There's not a lot of us. There's not a lot of libraries. Who's doing the coverage of this stuff? So we wanted to do something. We are the outreach library for the GMR in North Dakota. So we do outreach to public libraries, senior centers, etc. But when it came to tackling healthcare workers specifically, we didn't know really where to start, and we wanted it to be impactful. We didn't want to just willy-nilly do stuff. We needed to be thoughtful about our research, so we thought maybe we should do a little background work. So with that said, phase 1 started. And by the way, when we started, it wasn't called phase 1 because we thought it was going to be the only thing we were going to do 3 years ago. 3 years later, let me tell you, there's been a lot more. So anyway, I want to talk about our first what we first decided to do to get an idea about what was going on out in the state. So we decided we needed to do an information needs assessment of unaffiliated, and I'll explain that in a minute, North Dakota rural health professionals and biomedical researchers. So we're going to conduct a survey, and then our original plan was also to kind of look at biomedical researchers on at the tribal colleges. And attend some of the American Indian research events. Excuse me. And work and get a feel for that arena as well. So let me take a minute to talk about that. So the biomedical researchers, we originally planned to try and survey those people. They're at the tribal colleges. They're biomedical researchers. They even have subgrants from some of our PIs here at UND. But we kind of ran into some issues and concerns. We know they're there. We know they're working on the tribal colleges. We know that all 5 tribal colleges in this state have a library, but the library is often both the academic and the public library for that state or for that nation. And most of the tribal librarians are also may not have library degrees. Some do, but most don't. So we thought maybe they'd want our help. And so we first started attending the American Indian Research Symposiums happen here and in South Dakota pretty regularly. And we've gone to them before for other reasons. And we went and we were talking to people there about, doing their research and whether or not they'd, want us to do a survey and et cetera. And what we heard was there was a lot of research fatigue on the nations. They've been kind of researched to their wits' end. There's a lot of historical trauma related to the research that's done there. They're worried about adverse effects of any research done. You often need the approval of the IRB of the tribe and the tribal government to do anything with the tribal college. With all that, we chose to concentrate more on talking to the librarians at each tribal college, strengthening our relationships with them, because they are members of like the North Dakota Library Association. And we keep going to the research symposiums. We kind of collect unofficial data, but we chose not to survey this group. So everything that I'm going to talk about from this point forward is going to leave that out. And we are going to concentrate on the unaffiliated healthcare survey and everything that goes forward from that. So with that said, we created a survey in Qualtrics. We emailed the survey, or this link to the survey, to all the professional healthcare organizations in the state, like the North Dakota Nursing Association and etc. And we asked them to distribute it to their members. From that, we got 282 respondents. Honestly, I thought that was actually a pretty good response for, this random survey that came from UND. I was impressed with 282. So what I want to do now is I'm going to actually go through each question that we asked in the survey and let you see kind of what the answers were. So we asked first, what do you do? The biggest return was from nurse practitioners. 20% of those people, 20% of the answers were nurse practitioners, followed by occupational therapists, nurses, and pharmacists. We did have an other category. Other was often like nursing home administrator, those kinds of positions. So this was a kind of a not many physicians, unfortunately. I would have liked to have seen more, but I also know they're very busy, as all of these people. But I'm glad some of these people took time to fill out our survey. We asked what population area you practice in. About half, a little over half of them are in towns of 50,000 or more, which really are basically those five, those four large cities that I pointed out when I showed you the map of North Dakota. The other half are all from communities smaller than that. So we got about a half and half results there, from big 50,000 or more to less than 50,000. And then we asked this question: do you have affiliate status with the University of North Dakota? So I mentioned we're not affiliated with a hospital. We literally ship out all of our students all over the state and all over Minnesota, South Dakota, Montana. We basically said if you're not affiliated with UND, so you don't officially take UND students, those are the people we wanted. And we got 223 of those. The people who are affiliated with us, who were filling the survey out, at this point, they don't continue taking the survey. They went to another location and answered a couple questions for us differently. But the ones we care about and the ones we want to talk about today are the unaffiliated people. And so these people don't have any affiliation with the University of North Dakota, because those people that are listed there, the clinical educators, etc., they get library access as part of their agreement to taking students. So they have library access. These other people do not from UND anyway. All right, so those unaffiliated people kept going forward in the survey, and this was the next question they got: what is the primary purpose for which you seek information? And I want to point out, like, 60% of why they seek information has to do with patient care. If you look, 43% patient care, but 12% drug information. They're looking for dosing information, adverse effects, etc., and practice guidelines. All of those things are essentially patient care. So there's definitely, they're seeking information, and they're seeking it for the patients. It's very evident that that's their main purpose. Where are you most likely to look for health information? This question kind of confused me, and I think it confused our team, because 11.82% said they're looking for, they're most likely to look with a medical library or a medical librarian, but I'm guessing most of them don't actually have access to a medical librarian. So that was a kind of a interesting debate there. But this is kind of where they're looking. Other healthcare professionals, some of them have up to date, so they were looking there. Half the slides are cut off for me. I will let Derek take that. All right. So the next question was, what specific information resources or type of information do you wish you could access? And it was journals, patient care, treatment information, practice guidelines, those kinds of things. Up to date showed up on here. Ironically, so does PubMed. There are people who said, oh, I wish I could access PubMed. I'm like, oh, you can. Maybe we should talk to those people. So the next question was, do you access professional association member-only sites for information, and which sites do you access? I just put the whole chunk here. These are a variety of things. We were asking professional association member-only sites, but I noticed things like Dynamed and Up to Date actually show up here as well. LexiComp is in here. So they were, I don't know if they interpreted that to mean anything you had to put in an ID and a password for, or you have to pay for maybe. But that's a wide variety of places that people are going. Usually whatever their profession and specialty is looks to be where they're going to look for information. Do you currently pay for any personal subscriptions? And yes, some were, 40% said they paid. Again, we didn't ask for specifics here, so I'm not sure if they're paying for their own access to Up to Date, or are they paying for their membership to AOTA, and therefore they're getting journal and OT search and stuff like that. So I'm not sure exactly. We didn't specify here. This is the it was just a yes/no question. So, and finally, would you be willing to speak with someone at a later date? If they said yes, they left the survey and went to a completely separate place, and that is where they actually put their name and stuff. So no names were associated with the survey at all. And if they said no, it was the end of the survey for them. So basically, concluding phase one, what we saw from the survey is the primary purpose for seeking information was patient care. And that it didn't seem to matter in North Dakota if you lived in Fargo or a small town. There were people with unmet needs everywhere. Some people weren't even aware of some of NLM, or that there are free resources to do some of the things that they're asking about, like drug information, etc. So that's something that we needed to know. And that they do want access to journals and databases. They didn't mention how much they're willing to spend, but they want access. So we know that, and that helps us moving forward. So with that said, I would like to pause here. Do we have any questions, observations, comments? Go ahead and put them in the chat box. And Derek, you can let me know if there's any specific ones that you would like me to answer, or I know I saw Marcia has been answering some things for people.
Yes, so Marcia has been on top of the chat here, getting some good responses to people's questions. If anyone has a question that hasn't been answered, or that they would like a little bit more information on, please go ahead and put that in the chat. I think there was one that came in that asked if...
Yeah, was there data on specific information seeking, example, PubMed access to? Was there data on specific information seeking? I'm not sure I understand your question. Could you maybe elaborate a little bit, or if somebody knows what she's asking? Not sure I understand the question. Specific data, was there data on specific information seeking? So phase two, we actually interviewed people, and we were, what percentage wanted access to PubMed? Is that what you're asking me, is what percentage of the people wanted access to PubMed. Okay, so thank you for clarifying that for me. So no, because, well, actually there could be. Let me rephrase that. The survey, that particular piece of the survey was if you wanted access, it was a free form. You could fill in the words that you wanted. It wasn't like choose the things. It was literally just like freehand write in whatever you want. So we could go back and look at how many there were and how many people asked for things that are free, like PubMed or other things that were free, and say, okay, the percentage of things that people asked for that they should have already known about was via either PubMed or something else free from NLM was, 5% of that. But I don't have a specific number at this moment. So that I see what you're saying. What was the time span of the survey? I want to say, and Marcia, if you know the answer off the top of your head, I'm trying to remember if it was out for a month. I feel like it might have been a month that we had it out. We announced it. It was open more than that. 2 months maybe. Marcia says 2 months. So it might have been up for 2 months. Because you gave them choices. So you gave them choices what the resource was. Oh, you mean to how, like, journals versus, let me see if I can go. You mean this one? What are you most likely to look for health information? Well, we did have an other, so, or did they not know what these things were? Yeah, I don't know. That's a really good question. We went with this, and maybe it wasn't the best choice. Maybe we should have either offered other choices, or maybe this should have been a free answer question too. I think at the time we started all of this, we really were thinking more quantitative, and then you'll notice as we move forward here, we are now more qualitative. So let me move forward into phase 2. So phase 2, we had asked people if they're willing to talk to us, and so we said, okay, let's move forward and actually talk to people, and let's do some interviews with these people that volunteered, and kind of add a qualitative piece to what we're doing. So 21 interviews were conducted. Some were the volunteers that volunteered at the end of the survey, and some were leaders of healthcare associations that we asked to volunteer. And we did get a couple of people from there who said, yeah, we'll answer your interview. So we did 21 interviews. The team created an interview manual that had interview questions, a set of understandings for the interviewers to follow related to backup or asking follow-up questions, etc. We recorded them using WebEx when possible, and they were conducted over a 2-month span last winter. So the first couple questions in the interview were kind of what I would call the icebreakers, although they will bring us some quantitative information. What is your current profession? How long have you worked in this profession? Who's your clientele or your patients? Do you work with psych? Do you work with hospice? What is it that you do? And what attracted you to the current position you have? What brought you to North Dakota if you didn't already live here? What do you like about your work? So kind of what we would call icebreakers, but still getting us some data that might be useful in the future. So what I want to show you now are the interview questions, and then kind of the overarching feedback we got in the form of some of the quotes from the interviews. So one of the questions is, will you walk me through the steps you go through when you begin searching for information you need in your professional work? Do you start print, online, colleague, what resources, etc.? So this is the first question, and then let me show you this is just a sampling, 21 interviews, people. This is just a couple samplings of what responses we had that I thought that I would like to bring up to show all of you. So some of the answers: when I need information, I typically use the resources that are from my professional association. Yep, we saw that a lot. A lot of people like to go to the professional associations to get information. And then this one I thought was pretty honest. Like most people do, I go online, I do a Google search, I look for reputable sites. So she's doing some information literacy, even though she doesn't call it that. She said government sites, published magazines. I hope she meant academic journal, but I'm just going to assume that. But she said there's difficulties when you go online because then you can't get access because you have to pay. So then she's like, oh, I'm hitting the paywall. So we knew that was going to be part of that. One thing I find in public health, you always send out an email or a call and your colleagues will help you. And more often than not, I go to a coworker. And this was these quotes are they're sampling, but they kind of speak towards the majority of what we were hearing when we asked this question. It's, professional associations, coworkers, colleagues, Google search. I did like, of course, that she said she was, unbeknownst to her, doing information literacy and evaluating those sources. So this was a kind of just what we were seeing with that first question. If you had access to any and every information tool, would you still say that resource that you just said as the first place you would go? Why or why not? And is there anything you would change about your research methods? And what barriers do you face when you're trying to find information? Hindsight is 2020. Had we known now what we knew then, we would have actually separated these into two questions, but we didn't. So this is what we did, and let me show you kind of a sampling of what we got. Anything you would change? This was interesting. Several people were like, nope, I have what I need. Yes, I would use the tools that I'm already using. They get me what I need. They're applicable to my current industry. Okay, so I don't know if this was also hard for them to imagine, like they wouldn't know what they were going to do or what they were going to have access to. So maybe they couldn't put themselves in the shoes of answering that question. Barriers, if I had access to a librarian to call up and say, I saw this, or I came into contact with this, I need you to get whatever articles on this subject, that would be awesome. So barriers, not having access to ILL is how I would interpret that. Barriers, medical schools in North Dakota, and I assume they mean health science schools because there's only one med school, but there are a lot of nursing schools and other schools in the state, should be doing a much better job of reaching out than they do. They're a logical fount of information. They should be driving it, and they are not. So I like that the barrier is us, and that they thought we should be doing more outreach in that area. Obviously, time and money, which is I'm sure you hear every time you talk to somebody, and time and money we do hear a lot. So that was I was going to say time and money, and lack of ILL, lack of ability to get full text articles. That was one of the barriers. But I want to share with you and what I think is the best quote and one of the most impactful quotes that we got during this interview, in my personal opinion. It's this: the biggest barrier is time. I think most people wish that there would be someone that could work with them, that could help research and get data for people. I really think time is the biggest issue. Then the next barrier I find is always knowing the right words to put in when I'm trying to find something in a database. And not always do I get the right articles to come up with the right data. It's just like sometimes I'm missing it. I think these are my two biggest challenges. So her two biggest challenges is she doesn't have a librarian. And if I could go backwards in time, I would find all of those hospital administrators who thought getting rid of the library and the librarian was a good idea and shake them. I don't know what else to say. I wish that I could go back in time because these people need medical librarians and they're not there for them. And the healthcare workers are saying it without saying it right here. And hopefully I can use this to prove a bigger point, as you'll see when we move forward. So the next question was, and we had two versions of this question because we were talking to healthcare workers, but also administrators. If you're a healthcare worker, when you look for information to share with a patient, where do you go? For an administrator, when you look for information to share with a colleague, where do you go? And some of the answers for that: CDC, reputable site, trusted publications. I thought this was interesting. They struggle with finding information for kids. I thought that was interesting. Most of the time we have what we need. Patient care, we got that part taken care of. administrator likes to go with all places where they've already searched the evidence and found out what the best evidence for interventions are. So in my opinion, he's looking for guidelines, or she's looking for protocols, procedures, those kinds of things. This was an interesting question. In an average week, how much time do you spend looking for information? 4 to 8 hours a month. It depends. 5 to 8 hours a month. I'm thinking this is not something they track. It's not like lawyers. They're not going to bill back for it. So they're not really tracking this kind of information. So I really like this next one because I thought it was pretty honest. An hour a week, sometimes, probably more, depending on the types of things we're working on. Seems like the time of year can affect that as well. Maybe it is more time now that I'm thinking and talking through some of these things. Might be more than an hour. Might be 2 or 3 hours a week that you actually think about everything you're doing. I would argue she's probably more close to the answer than those, 8 hours a month things, because they don't think necessarily a lot about what they're doing or how they're doing it or what they're looking for. And so I thought that was a well phrased way of answering that question. And if training was available for you, how would you want that training? Can you tell us how it would be most effective for you? And some quotes related to that, and I don't think this will surprise anyone. They have less flexible schedules. They want something online. They want a webinar. I thought this was really interesting. Anytime we go to a meeting we have to travel to, we're spending a minimum of 4 hours of windshield time. I hadn't heard the term windshield time until we did this survey and interviews. Because I thought that was very interesting. We're in like I said, a rural state. Most times when they have these things, they're in the big city. So if you're going to have an event in Bismarck, a training that's for 2 hours, most of these people are going to have to drive a certain amount of time to Bismarck, spend the time there, and then drive back. And then they lose face-to-face time with their patients. Not just the 2 hours in the session, but the 4 hours to and from Bismarck and the 2 hours in the session. So I think that's very interesting that they mentioned the windshield time as part of the problem. That's why they prefer webinar, interactive videos, etc. And I really like that somebody pointed out that we want something we can access any time of day and that you can pause and come back to. I'm like, yes, I prefer mine that way too. So I thought that was well stated. So that was the entire interview and the questions and some of the overarching answers. And basically we concluded that they rely mostly on professional associations. A lot of people on the Department of Health in the state of North Dakota. Some of them get external funding, and so they often rely on whoever's providing the funding to provide information as well. And that didn't come out in this quotes, but that was something we kind of drew to a conclusion after kind of looking at the big picture of all the interviews. And that, again, it doesn't matter if they're in a rural setting or an urban setting, there's unmet needs in the state. So my team, we sat down in March of 2018, so 7 months ago, 8 months ago, whatever, 9 months ago. And we looked at all the interview data. We kind of looked at the big picture, and we acknowledged that there's things we need to do, and we need to go forward with a phase 3. The interviews identified some things that we knew that were free resources that people would need. So we were going to try and do some trainings and etc. So we decided to go ahead and go with phase 3. Which we are currently doing now. This one is not done. Phase 3 is not done, but I can talk about what we've done so far related to trainings and comprehensive analysis. So 2 groups that came out of this that were what I would say is really, we heard very loud and clear, were the OTs who in fact want a CE of some kind with evidence-based practice and resources that are free to them. So we're working on that. And other training opportunities have come about as well. And that's actually affecting our work as outreach librarians in the state, that there are groups out there that we want to talk to, especially the public health nurses. We are doing our best qualitative research right now. We are coding our interviews. We're looking for even more insights that we didn't get just from looking at the big picture. And we hope to, of course, present and publish with in the future, if possible. So I did want to take a moment. We want to take a moment to talk about lessons learned. These are things that we learned over the whole 3 years that we've been working on this, all the phases. It takes way longer than you expect to do this stuff. We all have full-time jobs, some of us more than full-time. And so it's hard to squeeze some of this stuff in. It takes longer to figure out some of the things that are unexpected, that we weren't expecting. The more you learn, the more you realize you don't know. So like I said, windshield hours, windshield time I was like, wow, I hadn't thought about that. And as I said, this is already affecting our role as the GMR Partner Outreach Library. We are making decisions about partner outreach things related to what we heard from our survey and from our interviews. So what we originally started out with, we are doing. We think librarians should take more opportunities to listen to their healthcare professionals. No, don't make assumptions about information access. Like I said, some people were perfectly happy. They didn't really care that if they wanted anything more. And other people, as you'll see on the next bullet, were really eager to engage with us. They loved talking about this, and they were really excited about what we could possibly do. And I came from the state of Washington, and they have HEALWA, and I saw that Pat Devine's on this message, or on this webinar. They have HEALWA there. They do provide information to healthcare workers throughout the state, as does Alaska, Oregon, Arizona. I feel like we need to do something here. I don't know what that is. I don't know how to go about doing it. We need to find the right people and bring them together so that we can make something happen in the state, we hope. With that, I will show you the best picture I've seen of ground drifting in a long time. And questions, final thoughts, questions. Derek, any questions that I need to answer that I haven't been reading the chat for the last little while, so please let me know.
I love that picture.
It is a really good picture of ground drifting. This is pretty much, if you go out of the city, this is what it looks like right now. If the wind is blowing and there is loose snow, this is what you see.
Yes.
So
for all of our non-rural northern state settlers, this is
yep.
So,
Yeah.
yes,
I see we answered the question. I actually, I don't know who asked about AHEC, but an AHEC person. Awesome. We met with so we have a Center for Rural Health, and we actually met with them last spring and said, hey, by the way, we don't know if you know this or not, but there's no hospital libraries left. There's no hospital librarians. And there's all these people out there who don't have access to journals and other things. And they were stunned. They had no idea. And I said, AHECs used to provide this service back in the day. In North Carolina, they still do. And I even said that. And they said, yeah, it is a possibility of some place to look at as a place to re-up the ante in this state. That's one solution. I don't know for sure what the solutions are. I mean, we got to find somebody more important than me to be the person who's going to lead. We can be there for the stats and helping figure things out, but I don't have the political power in the state of North Dakota to make this happen. I need to find those people. So, and AHIC might be the place that it ends up, but I still need some other people to help with that.
There are a couple more questions. So one, there have been some questions about whether the slides would be made available. Is that something that you're able to share with the data at this point, or?
I believe that these slides would be fine to go out. I don't know whether or not, my brain is not functioning. I wouldn't be able to figure out who's on this, so maybe it would be better I know you have the slides, Derek. It might be easier for you to send them out to the viewers, because you'd have a list of who's.
Yep, if you registered for the webinar, I will include the slides with when the recording is available. so everyone can have access to those slides as well.
Excellent. There you go for whoever asked those questions about the slides. Derek will send them because I was like, I don't have a list of all of your names. So thank you. That works. And I don't see any reason why the slides couldn't be shared. And have you talked to Minitex specifically about being like doing something for the state? Jim, is that what you're asking about? Or yes. Okay. No, I haven't. And that's a really good question. I don't know if you know this or not, but the director at the University of Minnesota, Janice, and I can't pronounce Janice's last name right now, but she was looking at doing something for the state of Minnesota, and she was going at the legislature with hers. And I don't know if she ever reached out to Minitex during that time or not. I have not reached out to Minitex. Minitex is hard because there's only a few things that I can actually buy through Minitex because they're not healthcare focused. Like I can't get my science direct through them, even though the rest of the university does, because what I need is very specific and they can't help me. So I don't know that it's going to be the best solution. It could be part of the solution though, if part of the solution would include maybe sending things to individuals in the state. I don't know. So it's something to consider. Oh, hi, Heidi Sue. I see she said thanks. So I haven't seen her in ages. Any other questions? I will put one more slide up. This is my email address if you have any comments or questions that you want to ask me. This is the view from my office, by the way. So I just took those pictures like within the last week. So it looks like that today. Actually, we have more frost now, but that's my current view. Anything else that I can answer? Did I miss anything?
There was one other question, and this will probably not have a direct answer, but if people describe needing a librarian without really understanding it, how do you convince them that you can help, or what's the message that you think can convey that?
Oh, that's a really good question. Because if I want to do something like at a state level, I'm going to have to figure that out. Like, how do we say that this is, that what they're describing is actually that they want a librarian? I think you'd have to find, so just like we have quotes from them, we would have to find some quotes from people who are using librarians in healthcare settings and say, oh yeah, I never do those things that she's talking about. I just hand this over to the librarian and the librarian does this. Or this is the kind of information that I get from my librarian at the hospital. This is what I get from this person. So it might take the two sides to every story kind of argument. Like, here's what this person is saying. Oh, and here's what this person is saying. And you know what the difference is? This person has a medical librarian and this person doesn't. Yeah, comparative data would help. Yeah, some kind of back and forth story. Telling the story is really like the good part. And to get that actual, I don't know what that person was. Let's say that person was a nurse, said that quote about, needing something. And then on the other side, finding somebody who is a nurse that has a librarian and getting both of their stories and then putting them side by side and saying, do you know what the difference is between these two people? This person has a librarian and this person doesn't. This person got 3 hours back to their day and this person didn't. Anyway, that's my thought on the process. I'm a fast talker.
Yeah, this has been lots of really good information packed into the hour here, and thanks for being willing to share the slides and to follow up with possible future presentations and publishing. I think this will be helpful for many people outside of North Dakota as well.
Awesome.
I am going to throw the URL into the chat box right now. This will take you to the evaluation, and we'll give you instructions for receiving your Medical Library Association continuing education credit if you're interested. Even if you're not interested in the credit, please do fill out the evaluation, as it does help us understand what you took away from this presentation. And we'll leave the presentation running for the next 5 minutes or so, so you can take the evaluation. But if you have any final questions or thoughts, feel free to throw those in the chat box before we wrap up in just about 5 minutes.
Thank you, everyone, for attending, for giving us part of your day. I hope I didn't put anybody to sleep, but I do appreciate my entire team appreciates you guys being interested in our project. Marette, I see your question about pharmacists. I'm off the top of my head, I don't know specifically, but Erica or Marcia might know more about the pharmacist answers. And I don't think we kept it like the pharmacist said this or not. And I don't know if we interviewed any pharmacists. So Marcia or Erica might be able to chime in on that. It's a really good question, though. Okay, so we probably didn't interview any pharmacists. And we can't, in our survey, we wouldn't have been able to tell. So they chose that they were a pharmacist, but I don't think was the pharmacist then tied to the rest of the answers? I don't think it was. Actually, we could, and it was. Ha-ha. There was a pharmacist, because 5% of the answers were pharmacists of the people who answered the question. So I know there was pharmacists who did the survey, but finding out their specific answers, Erica could probably figure that out. Yeah, about 13% of the overarching survey takers were nurses, not nurse practitioners. And so yes, the same would be you could be able to tell the same, just if Erica were to look, she could be able to see which answers came from nurses, I think. Yeah, I don't know if we interviewed a pharmacist, but I think we did. Yep, to AHIC and the answers for nurses. Yeah, we could figure out if the nurses were happier or happy with their resources or not. Oh, so we did have a pharmacist in the interview. Excellent. We are still coding all the interview articles. For those people who are still here, we're still coding. So we still have, we're still working our way through everything. We have some quotes. We had looked at the big picture, but like digging down into each one of them, we're still doing that. So we're still collecting some data in that realm. Yes, those people in Fargo, you can get together and have some coffee and talk about the project.
All right, well, I think we've pretty much wrapped everything up then. I'm going to go ahead and end the meeting for everyone. Again, I will send an email probably within the week with a link to the recording of this webinar. I'll include the slides, and I'll also include the link to the evaluation just in case you missed it this first time around. So you'll have a chance to take that if you didn't get it through the chat box. But thank you again, Kelly, and to your team at UND for doing such a great job managing the chat and presenting. And we look forward to seeing what other results come out of this project.
Us too. It'll be interesting to see what other good things we can find. And thank you again, Derek and the GMR for having us do this.
Yeah, great. Thanks.
Bye.
Thanks for watching. This video was produced by the National Network of Libraries of Medicine. Select the circular channel icon to subscribe to our channel. Select a video thumbnail to watch another video from the channel.